It is open enrollment season for both workers and retirees.
With plans changing, CBS News business analyst Jill Schlesinger is here to help us guide us through that process because we know it can be complex. Jill, great to see you as always. Look, we know more than 150 million Americans, they buy health insurance through their jobs. Where should they start right now, this process?
I know what you want to do. You just want to check that box that says, do the same thing as last year. That's not smart. Let's try to really figure out whether your doctors and prescriptions are still covered under your current plan. Now, if they are, okay, maybe you do check that box. But if not, you may want to look at other options through your company. One that I just want to highlight doesn't get enough attention is called a high deductible health plan. That offers a lower premium in exchange for a higher deductible. Now, to pay for that higher deductible and other out-of-pocket costs, you get to pair a high deductible plan with a health savings account. These are such great options because an HSA is triple tax advantage. The money that goes into the account goes in without a tax. The earnings grow without a tax. When you pull the money out, even if it's decades in the future, no tax due. So do check out those high deductible plans if they're offered.
All righty. So also open enrollment for Medicare. What if you're over 65? What do you need to know there?
Well, it's also open enrollment. As you said, we have until December 7th. And during this period of time, the thing about Medicare is there can be enormous changes year to year. You can enroll, change, or drop a Medicare Advantage, that's known as Part C, or you can add or change a prescription drug plan. That's Part D. Now, remember, these plans really are whipping around. Some companies just leave states altogether, so you got to spend some time with them. Same process as with the employees. You just want to look at what's covered, your doctors. Maybe you've got new drugs that have been prescribed. You just want to check on this. We do know from research that when you focus on the process, especially for Medicare, the one who does that is even just for the prescription drugs, they can save up to 5 to 10% the following year. So that's worth your time, isn't it?
Also, it is. And also here in Minnesota, UCare, one of our major healthcare insurance providers, is dropping some of their Medicare coverage. So check out Jonah Kaplan's story at WCCO.com. That's happening in Minnesota. Affordable Care Act, that opens up enrollment November 1st. What's expected next year for costs?
Well, I mean, this is a real big question. We've got 24 million people who are covered by the Affordable Care Act. But of course, the government shutdown is really a battle over the Affordable Care Act's enhanced premium tax credits. Those tax credits, we had the original tax credits when they first announced Obamacare. Then these enhanced credits under Biden helped to defray the costs. We're looking at those tax credits ending at the end of this year. So I think you're going to be on the hook for rising premiums next year.
Got to be prepared right now. Jill Schlesinger with that important information. Jill, thank you. You can see Jill regularly on CBS Mornings and the CBS Evening News. If you'd like more analysis, you can go to JillOnMoney.com.